Troubleshooting urethral catheters, tips and tricks. Urethral catheterization is one of the most commonly performed procedures today and may be used for diagnostic or therapeutic purposes. Some of the most common problems encountered by practitioners include unfamiliarity with different types of Foley catheters, placement of a stat lock device, how to determine if a Foley catheter is in place with irrigation, and running of continuous bladder irrigation for hematuria. Types of catheters. There are many different types of catheters that may aid healthcare practitioners in the drainage of urine. These include the silicone Foley catheter for patients that are latex allergic, a latex or soft three-way catheter used in irrigation of the bladder, and a symplastic or silicone three-way Foley catheter. The symplastic or silicone three-way Foley catheter is sometimes preferred by urologists as it has a larger opening at its tip and can be used to more easily remove large blood clots or sediment. A Coudet tip catheter is another specialized catheter. Its curved tip is designed to allow placement in male patients with enlarged prostates or BPH. As you can see in this picture, the upward curve of the prostate and bladder neck is mimicked by the Coudet tip of the catheter. An easy way to tell if the tip of the Coudet catheter is pointed up when the catheter is in the body of the patient is by looking at the balloon port. As you can see, when the balloon port of the catheter is facing up, so is the tip of the catheter. Stat locks are used to secure the Foley catheter to the leg of the patient in order to prevent movement or tugging of the catheter. This is an example of an open stat lock, and this is what a stat lock looks when it is closed. In a stat lock, the arrow of the clip should be facing towards the patient. Correct placement of the stat lock has a balloon port facing downwards, as seen in this picture. As seen in this video, when a Foley catheter is placed correctly within a stat lock, it should fit easily into place like a puzzle piece. When the stat lock is closed, it should close easily with the Foley catheter in the correct placement. These are examples of incorrect placement of a stat lock. In the picture on the left, the balloon and outflow port are not secured, which allows the catheter to move freely. In the picture on the right, the balloon port is folded in on itself. Both of these methods can lead to damage of the catheter or failure of the stat lock and should be avoided. A three-way Foley catheter can also be secured with a traditional stat lock made for a two-way catheter, as seen in this example. The balloon port and outflow port should be secured with a third irrigation port left outside of the stat lock. Irrigating a Foley catheter. A Foley catheter may need to be irrigated for several reasons. One would be to confirm catheter placement in a patient when the Foley is not draining. Reasons that a catheter may not be draining may be due to either renal failure or obstruction of the catheter itself. Another reason would be to remove clots or sediment blocking the catheter. Certain supplies are used specifically for irrigating a catheter. These include a sterile bowl for holding saline for flushing the catheter itself, a TUMI or catheter tip syringe for injecting the catheter, and cystoscopy tubing for continuous bladder irrigation. When checking for correct placement of a Foley catheter, the TUMI syringe is used to inject sterile saline. If the catheter is in place, the saline should return easily into the syringe. For patients with hematuria, pulling back with the TUMI syringe allows for the removal of blood clots that may be blocking the catheter. Irrigation of a Foley catheter is recommended if the catheter is not draining. If a patient is on continuous bladder irrigation and the catheter is not draining, irrigation is considered safe. If flushing the catheter does not relieve obstruction, a urology consult is then recommended. Thank you for your attention. This has been a video in clinical medicine from the Department of Urology.